Dear audience, Assalamu alaikum. I am Professor Shamsujjaman, Professor of Pathology. I welcome all in today's 19th lecture on pathology. Today, day 5 of lecture on inflammation. In day 4, I have told you about the last part of cellular events of acute inflammation, that is phagocytosis and release of leukocyte products. Today's topic is chemical mediators of acute inflammation. Chemical mediators of inflammation. First, we have to know what are the different mediators. Vasoactive amines, like histamine, serotonin, plasma proteases, such as Kinin system, coagulation fibrinolytic system, and complement system. Respected audience, these are the plasma proteases. These are present in our plasma as inactive form. They become activated in acute inflammation. Then arachidonic acid metabolites, platelet activating factors, platelet activating factors, then oxygen derived free radicals, oxygen derived free radicals, then lysosomal proteases, then growth factor, then cytokines. So these are the chemical mediators of inflammation. Dear audience, you know there are so many steps and events in acute inflammation. These chemical mediators are associated with different steps and different events of inflammation. First come to vasoactive amines. These are associated with the different steps and events of acute inflammation. The histamine and serotonin acts upon the blood vessels. These are the vasoactive amines. And plasma proteases, these remain as inactive form in plasma. In acute inflammation, they become activated. First, now come to Kinin system. This system includes bradykinin, and kallikrein. Now come to role of bradykinin in inflammation. Role of bradykinin in inflammation. Role of bradykinin in inflammation. It is associated with pain. Dear audience, you know in acute inflammation, pain the pain or dolor is one of the important cardinal signs of acute inflammation. Bradykinin is associated with the dolor, there is associated with pain. Then it is associated with increased vascular permeability. So it acts upon the endothelial lining of the blood vessels and causes increased vascular permeability, and that is why there is formation of exudates. Then it is also associated with vasodilatation. It is also associated with vasodilatation. In acute inflammation, there is first initially arterial constriction, then there is dilatation. And this bradykinin is associated with the vasodilatation. If the normal arteriole, this is capillaries like this is the venule, it causes dilatation of the vessel. So this is associated with the vasodilatation. Now come to role of kallikrein in inflammation. Role of kallikrein in inflammation. What's the role? It is associated with the activation of coagulation, fibrinolytic system. How it activates the coagulation system? It activates factor 12, that is Hegman factor. There is Hegman factor, so there is activation of coagulation system. Coagulation system. Another role, it is associated with increased vascular permeability. Associated with increased vascular permeability. How kallikrein causes increased vascular permeability? Activation of coagulation system. Activation of coagulation system. As coagulation system is activated, ultimately fibrinogen is converted to fibrin. So fibrinogen is converted to fibrin. During conversion of fibrinogen to fibrin, what happens? One product is formed that is called fibrinopeptide. 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 This peptide is associated with increased vascular permeability. This fibrinopeptide acts upon here endothelium and causes increased vascular permeability, and so there is exudates. So by producing fibrinopeptide, it is associated with increased vascular permeability. Another product, fibrin split product. Fibrin split product, it is produced during the lysis of fibrin by fibrinolysin. That is, fibrinogen is converted to fibrin, and this fibrin undergo lysis by fibrinolysin, And during lysis of fibrin by fibrinolysin, a product is formed. This is called fibrin split product. This is called fibrin split product. This fibrin split product is associated with increased vascular permeability, and ultimately there is exudates. This is the role of kinin system in inflammation. Now come to role of coagulation, fibrinolytic system in inflammation. Audience, you know, during activation of coagulation system, there is formation of fibrin split product and also formation of fibrinopeptide. This fibrinopeptide and fibrin split product is associated with increased vascular permeability. So this is the role of coagulation fibrinolytic system. Again, during the activation of coagulation system, formation of fibrinopeptide that causes increased vascular permeability, and formation of fibrin split product, it also causes increased vascular permeability. So the role of coagulation fibrinolytic system is increased vascular permeability. Now come to arachidonic acid metabolites. Dear audience, you know, arachidonic acid is a long chain fatty acid and it is present in cell membrane. It is a long chain fatty acid and it is present in cell membrane. Arachidonic acid is present in cell membrane. This arachidonic acid undergo metabolism. There are two ways of metabolism. One is cyclooxygenase pathway. When arachidonic acid, the long chain fatty acid, undergo metabolism with the help of enzyme cyclooxygenase, such type of pathway is called cyclooxygenase pathway. Another is lipooxygenase pathway. When arachidonic acid is metabolized with the help of enzyme lipooxygenase, then it is called lipooxygenase pathway of metabolism. Now come to what are the products we get when arachidonic acid is metabolized with the help of cyclooxygenase pathway. Products or metabolites in cyclooxygenase pathway. In cyclooxygenase pathway, what are the metabolites? One is prostaglandin, another is thromboxane, A2, another is prostacyclin. So the metabolites are prostaglandin, thromboxane A2 and prostacyclin. Now come to role of prostaglandin in inflammation. It is associated with pain, that is dolor. It is associated with pain. We get bradykinin is associated with pain and prostaglandin is also associated with pain. It is associated with increased vascular permeability. So there is formation of exudates. Now come to role of thromboxane A2. Role of thromboxane A2. It is associated with vasoconstriction. vasoconstriction. So if this is the vessel arteriole, it makes it constrict like this. So this is vasoconstriction. It causes vasoconstriction and decreased flow of blood in the affected part of tissue. Another role, it is associated with platelet aggregation. Platelet aggregation. So it is associated with platelet aggregation in the vessel wall. Now come to role of prostacyclin. Role of prostacyclin. What it does in inflammation? Just reverse the role of thromboxane A2. It causes vasodilatation and it inhibits platelet aggregation. Inhibition of platelet aggregation. So this is the role of prostaglandin, just reverse role of thromboxane A2. Now come to metabolism of arachidonic acid by lipooxygenase pathway. When arachidonic acid is metabolized in lipooxygenase pathway, there are some metabolites. What are the metabolites? Metabolites are leukotrienes. Leukotrienes may be leukotriene B4, leukotriene C4, leukotriene D4, leukotriene E4. All are the leukotrienes. These are the chemical mediators. These are derived from the arachidonic acid when it is metabolized by lipooxygenase pathway. Now come to role of leukotrienes. Role of leukotrienes in inflammation. First come to role of leukotriene B4. Leukotriene B4 is the potent chemotactic agent. It is a potent chemotactic agent. Potent chemotactic agent. Respected audience, you know chemotaxis is the unidirectional movement of leukocytes towards an attractant. Important or very potent attractant is the leukotriene B4. And now come to role of other leukotrienes. Role of other leukotrienes. Other leukotrienes C4, D4, E4. What is role? All are associated with increased vascular permeability. All are associated with increased vascular permeability. So this is all about the arachidonic acid metabolites associated with acute inflammation. Now come to complement system. Complement system. Respected audience, you know we have complement system in our plasma, and this complement system remain as inactive form in normal physiological condition. In acute inflammation, the complement system is activated, and this complement system comprises with proteins. What are those proteins? These are denoted as or designated as C1 complement 1, C2 complement 2, C3, C4, C5, C6, C7, C8, C9 and others. So it comprises with about 20 components. How this complement system is activated in our body in inflammation, or how complement system is activated. There are three pathways of activation of complement system. Number one, classical pathway. When complement system is activated by immune complex, such type of pathway is called classical pathway. So activated by immune complex. That is complex made by antigen and antibody. You know, in glomerular disease, most important pathogenesis is antibody dependent mechanism. In that mechanism, the immune complex is formed and activation of classical pathway of complement system. Another pathway, alternate pathway. Alternate pathway of activation. This pathway is not dependent on immune complex. It is not immune complex dependent activation. Rather, this pathway is activated by bacterial toxin or by aggregated immunoglobulins. Dear audience, you know one of the glomerular disease, IgA nephropathy. The pathogenesis of IgA glomerular disease not dependent on classical pathway activation, but that disease is due to alternate pathway activation by aggregated immunoglobulins. Another pathway is lectin pathway. You know, lectin is mannose binding protein present in our plasma. It is mannose binding protein. You know, mannose is nothing but carbohydrate. So lectin is a protein. It binds mannose in our plasma. It is called mannose binding protein. If bacterial wall, suppose the bacteria, this is bacteria. If bacterial wall contains mannose here, M denotes mannose. If bacterial wall contains mannose, and if anybody is infected with this such type of bacteria, this lectin will bind with the mannose of the bacterial wall. If the lectin binds with the mannose of bacterial wall, then there will be activation of complement system. And such type of activation is lectin pathway of activation of complement system. Dear audience, so these are the pathways of activation of complement system. What may be the pathways of activation of complement system? If the complement system is activated by any way, there is production of certain products. These are called products of complement system after the activation of complement. So now come to the products of complement system. What are the products? C3b. Dear audience, you know C3b is an important opsonin. It is associated with opsonization. You know, opsonization is the important step of phagocytosis. So C3b is derived from complement system, and this C3b is associated with opsonization. Associated with opsonization. Then C3a. C3a, it is a product of complement system. It is associated with increased vascular permeability. It is associated with increased vascular permeability. Then C5a, it is also associated with increased vascular permeability. At the same time, C5a also acts as chemotactic agent. So it is associated with increased vascular permeability. At the same time, it is associated with chemotaxis, that is, acts as chemotactic agent. Acts as chemotactic agent. Dear audience, C3a and C5a both are associated with increased vascular permeability, but C5a, in addition to increased vascular permeability, is associated with chemotaxis. Now come to, if blood vessel, if this is the endothelial lining, how the C3a and C5a causes increased vascular permeability. C3a and C5a both acts upon mast cell. Suppose this is the mast cell, and you know mast cell contains granules. Mast cell contains granules. When these two or acts upon mast cell, there is degranulation. There is degranulation, and due to degranulation, there is release of histamine. Histamine. You know, histamine is vasoactive amine. It acts upon the blood vessel, and it causes increased vascular permeability. It causes increased vascular permeability, ultimately formation of exudates. Now come to another product of complement system, that is membrane attack complex. MAC, membrane attack complex. What is the role of membrane attack complex? Role of membrane attack complex. Suppose this is bacteria and this is the bacterial membrane or wall. This MAC acts upon it and causes lysis of bacterial membrane. Causes lysis of bacterial membrane. So these are the role of complement system in inflammation. Dear audience, today up to this, thanks all.